name is Lisa. I'm going to be doing my head-to-toe assessment on Brian. Before Brian came in, he emptied his bladder. I took his height and weight and his vital signs, and now he put a gown on. So the first thing I'm going to do is inspect his head, making sure it is round, normal cephalic, that there's no protrusions or indentations. I'm going to take a look at his eyes to make sure that they're lateral along with his ears, that they're uniform on each side. I'm going to feel his scalp, making sure there's no indentations, masses. I'm going to feel his hair, making sure it's evenly distributed throughout. And I didn't feel any indentations, and his scalp is freely movable. I'm going to feel around his facial bones, and then feel his frontal sinus, maxillary sinus. Was there any pain when I did that?
No.
And then I'm going to have you check his temporomandibular joint, have you open and close and open and close. And there was no popping or clicking and any pain when I did that. And next I'm going to check his cranial nerves. I'm going to have you clench your teeth, close your eyes, wrinkle your forehead. I'm going to have you stick your tongue out, smile, and puff out your cheeks. All right, and now I'm going to test the light sensation. So I'm going to place this cotton tip on your head and just let me know when you feel it.
Now. 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 Now.
Great, and that's testing cranial nerves that both sides of the face are feeling sensation symmetrically. And now I'm going to be moving on to his eyes. I'm going to make sure that they're lateral. I'm going to take a look at his eyebrows, that the hair extends out to the outer canvas, that his eyelashes are full and curl outward. I'm going to have you close your eyes, looking to make sure there's no lesions on the eyelids. I'm going to have you open your eyes. I'm going to check the sclera and conjunctiva. The conjunctiva is pink and moist. The sclera is white with no yellowness or redness. I'm going to feel your lacrimal apparatus, making sure there's no edema or pain or exudate. Any pain with that?
No.
I'm going to check his pupillary response, looking for direct and consensual, I'm going to do that on the other eye, direct and consensual, direct, consensual. All right, and now I'm going to do the cover and uncover test. I'm going to have you cover your right eye. I want you to look at a fixed point. And now I'm going to have you take that off. And I'm taking a look, and you can take that off. Taking a look at the pupils to make sure that there's no laziness or nystagmus while he does that. And next I'm going to check his extraocular movement. I'm going to have you follow the tip of my pen light. And that too, making sure that both eyes followed it the same and there is no nystagmus when that was occurring. Next, I'm going to go onto the ears. I'm inspecting the placement that the auricle lines up with the corner of the eye. I'm going to feel the auricle, make sure it's firm but soft. I'm going to take a look into his ear, looking at the tympanic membrane, making sure it's gray, pearly gray. There's no drainage. And next I'm going to do the Weber test, checking for hearing in one or both ears. So I'm going to strike the tuning fork, place this on your head, and let me know if you hear it in one or both ears.
Oh.
All right, and now I'm going to check air conduction versus bone conduction. We'll place a tuning fork on his mastoid bone, and let me know when you aren't able to hear it anymore.
No.
And then next to your ear.
No.
Okay, I'm going to do the same on this side.
No. No.
And the air conduction should be heard 2 times longer than the bone conduction. And now I'm going to take a look at his nose. First, I'm looking at the skin color that is uniform throughout his face, making sure that the nose is midline. I'm going to take a look at the septum, making sure that is midline. I'm going to take a look at in his nostrils, that the hair is evenly distributed. I'm looking at the mucous membranes, the turbinates, that they're pink with no drainage or redness. And now I'm going to check the patency of his nose. I'm going to have you breathe out, and that's it. Great. And now I'm going to take a look in your mouth. I'm going to take a look at your lips, making sure that they're pink, that there's no lesions present, there's no cracks or fissures. I'm going to have you open your mouth. And I'm going to take a look at the buccal mucosa, making sure it's pink, moist, there's no lesions. I'm going to have you move your tongue to one side. Great. Looking at the tongue, making sure that's pink, moist, there's no lesions, and then the other side. And I'm going to have you lift your tongue to the roof of your mouth. Checking down below, making sure that there's no white leukoplakia lesions, which would indicate oral cancer. I'm going to take a look at the teeth, making sure that there's no decay present. There's 28 teeth. As I'm checking his mouth odor. I'm going to take a look if I can reach your head back. The hard palate, the soft palate. If you stick out your tongue, looking at the tonsils, the tonsil pillars, making sure there's no redness, exudate, and I'm going to have you swallow. Looking at the uvula, making sure it's moving up and down, and then I'm going to check his gag reflex. Stick your tongue out far, and that's present. And now I'm going to take a look at his neck. I'm looking at his neck, taking a look at the color, making sure that it's uniform throughout, there's no lesions. I'm looking at his trachea, and also the thyroid, that there's no goiters there. I'm going to palpate this area. I'm going to have you swallow, making sure the thyroid moves up and down, and the trachea is freely movable. I'm going to check the carotid pulses, one at a time, making sure there's no pulsations. I don't see any jugular vein distension. I'm going to have you move your head to the right. Yep, and then to the left. And have you then tip your head backward, forward. And then I'm just have you lift your head up again. I'm just having some pressure, and then back and forward. And then have you shrug your shoulders. Okay, and now I'm going to feel his lymph nodes throughout, looking for any lumps, any tenderness that he may feel. So I'm going to start with the preauricular, the postauricular, the occipital, the tonsillar, the submandibular, submental, pre-cervical, pre-cervical, post-cervical, preclavicular, deep clavicular, infraclavicular, and I was just having you bring your arms out just a little bit, checking the axillary lymph nodes. And any tenderness throughout that?
No.
Okay. And now I'm going to be moving on to inspecting the chest, heart, and lungs. So I'm taking a look at his skin color, if there's any lesions. I'm looking at his respirations. Make sure that they're not labored using any accessory muscles. I'm going to feel around and palpate. I'm going to feel the pericardium and looking for any pulsations, heaves, and at the apical pulse area, which is mid-clavicular line. I'm checking the apical pulse, making sure there's no pulses or heaves. And then I'm going to percuss, checking his lungs for renaissance throughout. I'm going to check the lateral aspect, making sure I don't feel any dullness. And now I'm going to take a listen to his breaths and heart sounds. And I'm going to have you take a deep breath in and out throughout. And I'm checking the lung fields evenly throughout. Comparing each lung field. I'm going to check the lateral aspect. And then I'm going to take a listen with my bell to his carotids, one at a time, making sure I don't hear any bruits, and also his thyroid. And now I'm going to listen to his heart sounds. I'm going to start with the the aortic pulse, the second intercostal space on the right sternal bladder, leading to the pulmonic, to the Erb's point, to the tricuspid, and the mitral valve. Hearing S1 and S2 throughout with no murmurs present. And now I'm going to have you turn around so we can take a look at your back. I'm going to start with the back inspection. I'm going to take a look at his respiration, making sure there's no labored breathing. I'm going to palpate throughout. And also inspecting the skin color. I'm going to palpate the costovertebral angle. I'm going to percuss throughout the lung fields, making sure I hear renaissance. Making sure I get the lateral aspects. And I'm going to percuss the costovertebral angle. Any pain in that area?
No.
And do the same over here.
No.
And now I'm going to be checking his diaphragmatic excursion. I'm going to have you take a deep breath and blow it out and then hold it. So I'm checking for dullness. I feel that right here, so I'm just going to make a mark on the skin. And then I'm going to have you take a deep breath and hold it in. Now it's right here. And you want it 3 to 5 centimeters away, which that is. And now I'm going to take a listen through his the lung fields throughout, having him take a deep breath in and out. And then I'm going to check her tactile prominence. I'm going to have you say 99.
99, 99, 99, 99, 99.
And I'm feeling for vibrations throughout. I don't want to see any diminished vibrations. And then I'm going to check his expansion. I'm going to place both of my hands on his back. I'm going to have him take a deep breath in and out, and I want to see both hands rise symmetrical. I'm going to have you take a deep breath and out, which that occurred. And now I'm going to have you lay on your back. I'm going to inspect his abdomen now. I'm going to take a look, making sure at the contour, making sure there's no distension, looking for any heaves throughout his abdomen area. First thing I'm going to do is auscultate his bowel sounds, checking all 4 quadrants. 2 to 5 minutes at each area. And then I'm going to check his aortic artery. That's step 1 here. His renal, iliac, and femoral. I'm going to palpate throughout, looking for, press throughout, making sure there's tympany. This will also help check for any masses, which would have a dull feeling. I'm going to check his liver border with percussing. I'm going to go downward. And I'm going to make a mark right here. I'm going to go upward. So I'll listen for tympany to dullness. We want to have 6 to 12 centimeters, which would be the liver border. I'm going to percuss his spleen. And dullness we will hear in the spleen area. And I'm going to do a light palpation throughout. I'm going to palpate his aortic area. I'm going to palpate a deep palpation in the liver, the right kidney. I'm going to have you turn a little bit towards me, palpating the spleen, which we won't be able to feel. I'm going to feel the left renal. And also, looking, make sure there's no hernias or anything present. All right. And I'm just going to have you lift up a little bit, checking his abdominal muscles. And now I'm going to have you sit all the way up with your feet hanging over to the side. I'm going to inspect his extremities. I'm going to have him bring his hands out. I'm going to look at the color, contour. Looking at the color, the hair's evenly distributed. I'm looking at his fingertips, that there's no clubbing. I'm going to check his capillary refill, less than 3 seconds. I'm going to have you turn and check your brachial pulses, comparing them that they're the same on each side, and the radial pulses. And then I'm going to check his tendon reflexes on both sides. I see a little jerk in his hand, and then the radial. And on the other side. And then I'm just going to check to make sure his strength. I'm going to have you push up, push down. I'm going to bring your arms to the side, up, and down. All right, you can rest your arms on. Now I'm going to take a look at his legs, making sure that there's no swelling or edema. Checking, feeling the temperature in his legs. The hair is evenly distributed on both sides. I'm going to feel his popliteal pulses in the back, the posterior tibia, and the pedal pulses. eye ladder on each side, which is uniform. I'm going to check his muscle strength and come towards me, against me, and your feet up and then down. I'm going to check your deep tendon reflexes on your knee. And then I'm just going to bring the camera down just a little bit to check the Achilles. All right, great. And they responded well on both sides. And now I'm just going to have you stand up. I'm going to check if there's any curvature in the spine. I'm going to have you bend down, checking the you could just cervical to the thoracic, making sure there's no curvature. All right, and you can stand up. And this is my head to toe assessment. Thank you.